I am a dentist. Are you? I am a pediatric dentist. I have spent a lifetime of practice treating children and teenagers and connecting with their parents. That's what pediatric dentistry is all about. And I have an idea for you that I have practiced now for over 25 years. And that is no sedation or GA pedo. Is that a radical idea or what? Now, I'm going to talk to you all, especially y'all young pediatric dentists, because you're coming out of school very well trained in sedation and GA, most likely, right? And I'm going to tell you a little story. When I went to dental school, I had been working in nursing for about 5 years, almost 6, as an RN in critical care. And then during dental school, I worked as an RN to help pay my expenses. And I was fortunate that I could do that because nurses work all kinds of hours and shifts, and so it worked out well. And so I had a great dental education at University of Kentucky, still in my heart of hearts, fantastic school. And I want to tell you something. There I was learning dentistry while I was still practicing nursing. Then I ended up, after I was out a few years, and then went back to Connecticut to become a specialist in pediatrics. Now, let me tell you what happened. I went to a school that was very involved in teaching behavior management that did not require sedation and GA. So it kind of suited my purposes because I realized that some of the then being used cocktails of Vistaril, Demerol, medications that we were giving the children, or people were giving the children, I wasn't, doses that were adult doses in my nursing experience. And I thought what we now call OMG, which I say to you, oh my goodness, we're going to give the children these doses? There's no way I could be comfortable with that. I evolved after my training eventually as a faculty member, becoming one of the attendings in the operating room. And of course, I was involved in GA dentistry, in particular for our special needs patients, both children and adults, who were literally almost impossible to treat in the chair. But I want to tell you something, doctor. I treat all children who aren't absolutely impossible to treat in the chair, and that's 99% of them right there in the chair. There are ways to do that, and it doesn't necessarily involve talking sweetly to them. Of course we talk sweetly to them. It doesn't necessarily involve tell, show, and do. Of course we do a little of that, maybe a lot of that. It does involve having the parents there. It does involve loving them. It does involve a lot of TLC, and it does involve things that make you a great parent as well. For example, firmness, sureness, bravery, and we can do it. And we can do a great job without the risks of sedation and general. You know, this is something amazing to me, that our profession as pediatric dentist specialists has evolved into one full of risk, full of several children dying a year in the United States in our chairs. That is absolutely frightening to me. And we think that's okay. Oh, of course we don't think it's okay, but we keep doing it, so somebody thinks it's okay. I challenge you, doctor, think about this. No sedation or GA pedo. It can be done 99% of the time. And I can show you and teach you how because I do it all the time. So, just a thought for you today. How about that?